It's been said, Dr. Bassett, that we're destined to repeat the mistakes of history if we don't learn those lessons in the future. And I want to ask you a question as it relates to the last couple of years and our previous commissioner of the health department. I want to know what lesson you may have learned, or maybe you haven't learned any lesson, but specifically what lesson you might have learned from our previous commissioner of health in New York State as it relates to his support and his assistance in implementing an executive order by our previous governor to place those who have this contagion, the coronavirus, into our most vulnerable population, individuals who are elderly and compromised in our nursing homes. And as we know, this coronavirus can just give you the sniffles. But if you're elderly or you're compromised, you have diabetes, heart disease, cancer, it can have a profound impact on your health. It can take your life away. We lost several of our nursing home patients, I believe, great degree, partially and to a large degree because of that executive order. And I'm wondering what lesson you can take with you and what you feel about that in terms of that executive action and the support of our previous commissioner, and maybe weigh in on the fact that it took us maybe 9 to 10 months in a lawsuit to have them actually give the numbers of those who lost their lives because of that contagion being taken into a nursing home. Any lessons learned, or any way you could tell us what your feelings are about that action by that previous commissioner supporting and helping to implement, putting those individuals who had the contagion in with our most compromised citizenry?
So let me start out by acknowledging Senator Tedisco that absolutely the strongest risk factor for an adverse outcome from COVID is age. I think it's close to, something over 830,000 people who've died. About 3/4 were over the age of 65. So this pandemic has really taken the highest toll among older people. And so, of course, concern about nursing homes is completely well-placed on the basis of age alone. And additionally, these are congregate settings, and congregate settings represent opportunities for more spread than individual households. So I decided when I took up this post that I wasn't going to try and unravel what had happened in the nursing homes under the previous commissioner, but simply look forward and to take what has guided me all of my working life, that, to put it in a sort of cliched way, honesty is the best policy, and that transparency about data is always appropriate, even when the data don't show what we wish they would show. And of course, this concern about nursing homes has also guided some of our recent actions, shipping test kits to the nursing homes, shipping higher quality masks to nursing homes so that visitors can have the opportunity for testing and masking appropriately, and keeping track of where we are with COVID. I get a report every day. We have Omicron in our nursing homes, but I'm happy to report that the number of deaths has been coming down. And we are taking action when we have certain metrics are tripped, and we ask the nursing homes to suspend visitation and advise them to consider stop taking new transfers. So that's what we're doing. I wasn't here, and I decided that I am not going to take the time to unravel the previous situation. I hope that answers you well enough.
Well, without unraveling the previous situation, if this governor or any governor comes to you or would have come to you and said, we have to accept the diversity and we can't discriminate against people who have a very contagious disease, and we're going to implement allowing them to come from hospital if they have this and go into nursing homes, what would you say to that governor? What advice
Well,
would
I'm a
you give?
doctor first and foremost. I'm a doctor first and foremost. I'll never give advice that I think will harm people. I will never give that advice, and I won't agree to follow it.
Appreciate that very much. Thank you. Best of luck.
I would offer to resign,
Thank
to be
you.
clear.